I welcome you all to the official launch of TUBITEHO Project, or Let's Take Care of Them, a project aimed to advocate for harm reduction services among people who use drugs in Rwanda. This project is mainly intended to improve the quality of life for people who use drugs, taking into account the gender and the human rights approach that recognize them as key population. I would like to introduce you different implementing partners that is taking the lead of this project. We have the Rwanda NGOs Forum in consortium with Health Development Initiative, Strive Foundation Rwanda, Médecins du Monde, and in support of the financial support from Expertise France. So this afternoon, we are going to have a brief program for the launch of this project with the agenda which we follow. As I'm going to say, we'll have a welcoming and the opening remarks from the Rwanda NGOs Forum. We'll then have a presentation of the overview of this TUBITEHO project with an emphasis on its objectives, activities, and also the expected outcomes. We'll then have discussion from different attendees here to better understand the projects and how we'll have different interventions. And then we'll have the closing remarks, which will all be closed by the group photo and the health break network.
Thank you very much. Dear Director General Rwanda Biomedical Center, His Excellency Ambassador, Embassy of France and Team France, honorable parliamentarians here represented in the room, security organs, Rwanda National Police and Rwanda Investigation Bureau, the City of Kigali, the Rwanda National Human Rights Commission here represented, development partners, CSO colleagues, and the consortium members. Good afternoon. My speech is just to welcome you all for being here with us on this very important occasion where we are launching a project called TUBITEHO. TUBITEHO, it's a Kinyarwanda name, but in English says, let's take care of them. Who are those? It's people who use drugs. So this project is mainly going to be responding on the issues related to harm reduction in HIV response, TB, hepatitis, and mental health issues. I'm not going to take you through the whole project because as you've seen on the program, there is a part for that. So I just welcome you all. Enjoy the venue, the discussion. As you've heard from the AMC after here, we're going to have a networking space where we are going to get to know each other and understand more about this project, discuss on how we are going to support through the implementation of this project. So without taking much of your time, I want first of all to call my fellow colleagues that we are implementing together this project so that you can see the team that is going to be supporting the national priorities in HIV, TB, hepatitis, and mental health response in the next 3 years of the implementation of the project. Dr. Kagaba Flodis, please, can you just come forward? Dr. Kagaba is the Executive Director from Health Development Initiative, HDI, who is the lead of this consortium. Mwananawe Aimable, the National Coordinator from IMRO. It's IMRO means Ihorere Munyarwanda Organization. Médecins du Monde. Médecins du Monde is an international organization that we went together into this consortium when we are developing the proposal, and they'll be coming in providing us with a TA, technical assistance, during the implementation of the project. And there is a colleague of us, Alice, from Strive Foundation Rwanda. And then myself from the Rwanda NGOs Forum on HIV/AIDS and Health Promotion. This is a team that worked together, a journey of 2 years We submitted a proposal in 2020. It was a concept note, and then we went through, and then we developed a full proposal. It was a competitive project, and then we went through it, and then afterwards we went through the due diligence. From 2020, then the signing of the agreement was done by end of September this year. Then the project started on 1st October, and this is now why we are here celebrating the achievement. It's a project worth 985,000 euros. That's 1 million, around $1 million US dollars. And through this, we appreciate Rwanda Biomedical Center and the CCM Rwanda, and UNAIDS. UNAIDS provided us with a TA, a consultant who supported during the development of the proposal. Then the RBC, of course, we are partners. We are contributing to the national response in health sector, and then submitting a proposal. Of course, you have to show the partnership you're having with the government. They supported us in providing a TA, reviewing the proposal, more especially the mental health division and HIV division, and then also provided the recommendations that supported the project. The CCM Rwanda, because Expertise France, in this particular call for proposal, they support projects that are complementing Global Fund projects. So that's how we show the need. We try to show a need, how we would be complementing the Global Fund supported projects in Rwanda, and then that's how the CCM came in. And then they also supported through providing a recommendation, supporting and justifying that we are implementers of the Global Fund. And then also we are working together. Some of us are part of the CCM. So I think this is a great achievement, which we need to celebrate. So congratulations, my team, we made it. So moving on forward, Dr. Kagaba is going to stay here and take us through the next step. Thank you.
Thank you everyone for coming. So I remember the process when we started. First of all, talking about implementing a program with people who use drugs. One of the first questions we had, is it possible? But we had explored that we have people who use drugs. Of course, that's a question people kept asking. Are you sure we have people who use drugs? I think this project is coming in a context that we know, and the organizations that are going to be implementing had some experience finding out that in the other work we are doing, because all the organizations are implementing key population programming for some time, and we have seen that we have people who are dependent, people who are using drugs among the key populations, very prevalent. We have done some initial data collection, which is not really enough, but we hope that this project is also going to contribute to more data. And I remember when we reached out, we were trying to see, can we get an organization in the region that can help us, that has some experience? And we reached out to MDM, who responded very positively. So for that, we are very happy. Of course, when you're applying for this kind of project, which is new in one way or the other, also Expertise wanted to find out, are you sure? Is the government of Rwanda going to support this kind of work? And I think I want to take this opportunity to thank everyone from the government of Rwanda. Director General, we appreciate. We know your time is very demanding, and making the time for me to be part of this process when we are starting the project is already another indication that the project is coming when it is needed. And I have no doubt that the milestones that we have given ourselves, we are going to achieve them together. So we got very good and positive support from the initial process. When we were writing the concept note, we got letters of support from CCM, from RBC, which I think was very instrumental. So it means that it's really a collaborative effort. So it's a project we are going to lead, but we do know again that the success is going to depend on the contribution and the commitment of everyone in this room. And we thank so much the French government for trusting and supporting this work, Expertise France. And we, of course, we are committed and energized. So for the past 3 days, this was the second day we have seen we have been discussing ourselves to understand what does harm reduction mean. And I think I'm going to go through a few slides and we can have a few minutes to discuss about the project. But the project mainly aims at implementing, exploring harm reduction. How do we reduce the harm for people who use drugs in Rwanda? And we're going to be carrying out different interventions. So please, if you could go to the next slide. So these are the partners. I think we have already introduced them. It's going to be a 3-year project. Next slide. And it comes from the background, as I said, that we know we have people who use drugs. Globally, numbers are quite very high. If you look at 275 million people worldwide who use drugs at least once in 2020, that's a high number. Do we know the numbers in Rwanda? We don't know. But again, we know from what we are seeing that people who use drugs, depending on what we call drugs, from alcohol to all other drugs, which you're going to find out what drugs are available in Rwanda, we are going to see how big of a problem it is. So we hope the project will contribute to some data. So we know that there are those who use drugs, and there are among them, globally, as you can see, about 11 million people inject drugs now, which brings in additional risks of HIV and hepatitis. And I'm happy that I see in the room very many colleagues who are involved in the fight against HIV, hepatitis, and other diseases. So you can see that the numbers are very high. And we do know for sure from data that people who inject drugs, for example, have a very high chance or a very high risk, 24 times more likely to get infected with HIV. And that's why this project comes, it's important because we are opening up another window to see among the key population that we are targeting, how is it among people who use drugs, especially those who are injecting, and what can we do to be able to collectively respond and mitigate the HIV risk. Next, please. As I said, Rwanda, we don't have much data, but of course, I know that I've seen the mental health department in RBC. I know some work is being done, and also we have had some initial data collection to see what's happening. So we know that we have people who use drugs. What we don't know is how big of a magnitude, how many are they, what are some of the other challenges they are facing, but we do hope that we are going to explore more as we identify and interact with the communities and the people who use drugs. These are some of the studies that we have conducted. There was one by Rwanda NGOs Forum that looked at people who use drugs, and there was very good evidence that we have people using drugs and we have people injecting drugs, and some of them, of course, are practicing practices that are not safe, including sharing needles when they are trying to inject, especially among those who inject. Please, next. We did, at HDI, we did conduct, trying to find out what's happening from the groups we've been trying to support. And we specifically focused on those who are injecting to try and see. We're able to do some HIV screening. And the initial results, of course, show that about 9%, over 9%, are positive, which is 3 times higher than the general population. That's quite alarming, knowing that we are talking about HIV prevalence among the general population in Rwanda, which is around 3%. It was a very small sample, of course. It must be understood that this cannot represent, but it's an eye-opening that something needs to be done. So we do know that practically, and from evidence, harm reduction is one of the interventions that is recommended globally by WHO, and we think that it is possible also to think about it in Rwanda, and that's why the project is really going to focus on that. Next, please. So looking at that context, we explored, and you know, under the framework of expertise, expertise France and the complementary work to see what's happening around the Global Fund, the 4 organizations that are implementing, Rwanda NGO Forum, Strive, HDI, already implementing with the key populations. So we thought, what can we do around this area? So we thought about the TUBITEHO Project, which is the project we are launching today. Is it the solution? Is it the only solution? I think it's just one of the solutions, because there are several solutions and there are different initiatives taking place already at country level. Please, next. So what are the objectives of the project? I see some syringes, but these are not the objectives. Eh? Just don't be... Next, please. Yes. So the project has the main goal. The main goal, the overall goal of the project is to improve the quality of life of people who use drugs in accordance with the gender and human rights-based approach. So we are thinking that these people are hidden, they have their challenges. How can we contribute to the quality of life? What kind of interventions? And the project has 3 specific objectives. Objective number 1 is contributing to creating a conducive and enabling environment to make quality harm reduction services for people who use drugs available and accessible. Now, when we say contributing to an enabling environment, as organizations, as civil society, we don't make law, we don't make policy, but we have a mandate to advocate. And that's why we're in this room to discuss and say what can be done. As you know, I won't go into the current legal framework, but we have legislation, we have the law determining offenses, which criminalizes the use of drugs. I think if I remember, I'm not a lawyer, but you may get 1 to 2 years if you are convicted of using drugs in any way. If you are using. If you are involved in the supply chain, it's a life sentence. And our main concern is really, because we don't have the expertise to do with those who are supplying. There are so many experienced institutions here that have that expertise. Our interest is in those who are using, who we see as people who need support. And that's why we are really going to be focusing on people who use drugs. So, contributing to enabling environment, I mean, discussing with each one member, that's why we invited Parliament, we're going to be engaging Parliament, but also with policymakers like RBC and Ministry of Health. What can we do to make sure that there is the infrastructure and the policy allows people who use drugs to be able to access harm reduction services, to be able to mitigate the danger, the risk that is associated with harm with the use of drugs.
I first wanted to congratulate the team that made happen this project. My name is Lanjila Lambe. I'm the country programs manager for AHF Rwanda, which stands as the AIDS Healthcare Foundation. At some point, the presenter, who is Dr. Kagawa, told us that the use of drug at some point is like criminalized here in Rwanda. So I wanted to know the role, or how did you work with the security organ that, just to know the law on their intervention while we be implementing this project. At some point I thought maybe these people, sometime when they are looking for the source of the drugs, your client at some point may be apprehended. So I wanted to know the role of security organ during the implementation of this project. Thank you.
So yeah, of course, the project will aim in all the advocacy meetings we talked about. We are going to be engaging security organs because the drug response. When we looked at the structure, I think there is an interministerial committee that brings together different institutions. Of course, there is the role of the police, which we cannot, it's not our expertise. The police has to do its work. But we are going to work together. And this is not the first time. I remember when we started working with the sex workers, people who have been there, I can see so many faces in the room, over the last decade. You remember that it was not easy. Sex work used to be a crime in Rwanda. It's no longer a crime. You'd be in a meeting with sex workers, you're seated with criminals, and you want to have a meeting. And of course, the police also is in charge of looking for criminals. What happens? But we had some good conversations on the importance of saying, yes, they could be doing something that's a crime, but we need, if we are to deal with HIV, we need to educate sex workers. We need to give them condoms. We need to ensure that they are getting access to treatment. And I think actually the police was very responsive. For a long time, the decriminalization happened in 2018, but even before 2018, we've been having active HIV programming for sex workers. You could meet sex workers, we talk, we educate them, we give them condoms, and when we understand, and I think that's why the whole idea of engaging with all those concerned and say, yes, we have people who use drugs, and the police has to identify them and take them to police or DASO and take them to Iwawa. Yes, but what do we do if someone is really addicted? Don't they need psychosocial support? Where can we send them? If someone is injecting and they're using dirty needles, and they are sharing needles. As we are still interested in educating them and how do we deal with that? So we are going to have those conversations. So I think we are going to collaborate very closely with the police and other law enforcement. We understand that it's not an easy task, but I am very, very optimistic, looking at the interest, considering the experiences that every institution has had, that there is room to have this conversation. And again, harm reduction is an approach that has worked. So we're going to be having a lot of sharing experience, some learning vids, some people sharing and say, how do others really, how are they able to contribute? So now, in the advocacy work, we are also hoping to start some conversations. And I think if we look at the practice, if we look at the current practice, I'm very sure the person who is addicted today, when they arrest, I think they are taking for rehabilitation. Already there is some, I'm already thinking that the decision is already thinking that this person needs some kind of help than being a criminal. So I'm looking at the context. This is the right timing. So we're going to work very closely, not only with the police, but with all the law enforcement to discuss on what is the best approach. What's the role of a psychosocial support expert? What's the role of mental health? What's the role of addiction managers? What's the role of us, civil society? What's the role of the people who use drugs, including those that have left the use, but have some experience, including those who can show us where the rigara is? So who can show us and we can do some condom programming. So I think it requires a collective responsibility, and I'm looking forward to that collaboration. I cannot, of course, anticipate, but I think from the experience we have had in the past few days, and also the support, we could not have got this project without the support of the government. And I think that's why I'm happy to see who is in the room, that we have an interest to work together and ensure that this harm reduction programming is effectively implemented. Doctor, I don't know if I've responded adequately.
Hello, good afternoon. My name is Karen from Médecins du Monde. I would just like to give an example of how we are working with the Drug Control and Enforcement Authority in Tanzania. Perhaps you know, but in Tanzania, the laws are more restrictive. Drug use leads up to sometimes 30 years of prison, sometimes even life sentences. So it doesn't seem very obvious to be able to work in this context on harm reduction. Now, the DCEA, so the Drug Control and Enforcement Authority, I don't know what the name is of the Rwandan equivalent, but it's the institution that you were mentioning, is our main partner, actually. So they have 6 departments, of which 5 departments are mainly involved with controlling every drug that comes into the country, stopping trafficking, stopping illegal drugs. They are also very much linked with the police department. The police department is our second main partner, actually. We are giving every year trainings in the initial training of the police officers, so in the police academy. Last month we gave a sensitization to all 1,200 police officers to be. And we see now it's like 13 years that we're working with the authorities on harm reduction, and the law has not changed yet. However, what we do see is that indeed many of the people using drugs come to the CSOs that provide harm reduction services, or come to the rehab centers, or come to the OAT, that's the opioid antagonist therapy clinics, or the methadone clinics, accompanied by police officers, because they see them now in the first place as people that are in need of support. So it is possible. It is possible, and as we discussed already in the workshop that we had, we think as MDM that the context in Rwanda is very favorable, actually, to be able to collaborate together to make a change in harm reduction.
My name is Gilbert Biraro. I'm the coordinator of the externally funded projects management unit in Rwanda Biomedical Center. So my question actually, first of all, I want to commend, these partners for competing and winning for this grant, which is coming to complement, the HIV or RBC National Strategic Plan, which, implementing such programs which are as yet unfunded by the Global Fund, and other partners. So hence my question, how does this project or how will this project complement, the Global Fund funding that you get or the other projects that you implement? How will this chip in into, that other Global Fund or other support that you get? Thank you.
The efforts will complement. We have had successful programming for key populations, especially focusing on sex workers, MSM. But when it comes to key population as people who use drugs, we've not really had adequate programming. And I think in our conversations within NSP for HIV, we have always said, yes, there's room to do something, but we don't have data. Yes, there is room to do something, but we don't know, how big of a problem is this? And we think that this project not only is directly contributing, but also is going to open up the window to show or to see the need. We're going to identify what are the needs among people who use drugs. How big of a problem is it? And are they accessing services? How is HIV? So we're going to be doing a lot of data as well, data collection, and we think it's likely to contribute to the implementation of the broader national HIV strategic plan, which of course will complement the Global Fund. But also, all the partners that are implementing, they are already Global Fund AIPs, and they're already working with the key populations, the group at high risk. For example, taking an example, not responding for others, in the groups that we have been working with, especially MSM and sex workers, we have seen firsthand the negative impact of people who use drugs. We have seen people who are dependent. We have seen people losing it. We have seen people struggling in these specific communities. So we think this will be an extra mile to see how can we better respond to the pandemic of HIV and STIs and other STIs, but also on the mental health of these individuals who are using and dependent on drugs. So we are looking at broadly identifying other interventions that are needed. We are looking at expanding and interesting other stakeholders to see that collectively we are adding more work and more stakeholders are opening up to work, and also ensuring that the community of people who use drugs are able to access services. And in one way or the other, we'll be contributing to the bigger implementation Global Fund supported plan. So we look forward to working together, and we're very excited. We think this is going to really generate some positive impact.
Thank you so much. My name is Dinamo Ndecha Isenga. I'm Director of Drug Abuse Prevention and Management in RBC. Just to appreciate the way this project is framed, and to comment that in Rwanda, like she said, we have interministerial committee to fight against drug abuse and illicit trafficking. I think every stakeholders, government, civil society organizations, and churches and faith all are represented. It is a good opportunity that the government of Rwanda takes this issue of drug abuse as a mental health issue that should be addressed by a complementarity of different services and interventions. So that's why sometimes you find people are not arrested. Yes, police can arrest, can take them, but when police has an intention to jail them, I'm just not talking on behalf of police, but when you go to transit centers, you find most of them are residing just in transit centers. I think that the country needs to find a holistic approach to address the issue of drug abuse. I'm talking this because I'm also sitting in that committee. So number two, I want to come back just on the conception of the project itself. So sometimes you see, we're talking about HIV, hepatitis, and other components towards substance abuse and drug injections. I would just to call your attention to make sure that the intervention is focusing to them should also look on how to support, to provide psychosocial support to those who are injecting drugs. Because me, as a mental health expert, I find out that those who decide to go to get injections, they are suffering mentally. They are having emotional problems. They are not having the one who can just support them in case they are suffering. So there is a need to provide also a holistic approach toward the mental health, and of course to support them in the psychosocial rehabilitations. It's one of the missing points that we have in this country. We have services, we have different interventions, but when you go back, you are finding out that different relapses are due to lack of psychosocial support program. So I'm calling out that when you are continue to address this issue, you should also think on how we can provide psychosocial support to these people, families, and so on. Thank you so much.
First of all, I think for me it's a pleasure to be here today to witness the launch of this project called TUBITEHO, which I think comes at the right time for many reasons. One is that we know that I think some of the people in the room have mentioned about some of the gaps that we are seeing in our interventions. If you want to talk about HIV interventions, we know that HIV, for example, with the support of different partners and working with other CSOs who are here and through the CCM, we have been able to make a great achievement in achieving the 95, 95, and 95 targets for HIV response. So I think there are some last mile gaps that I think we want to continue to work together to fill those gaps. And this particular group of populations for HIV, for example, some of the groups that are seen as a last mile population to allow us to fill the gaps in our intervention for HIV, hepatitis, and also any other infectious diseases. So I think this is something I wanted to really congratulate the consortium. It's really a good opportunity to see now consortium of CSOs calling us to be part of these applications. I think RBC has been really supportive from the beginning of this application. And this shows again how we take seriously the involvement of CSOs. So again, this is something I think I want also to congratulate the consortiums that have been working on for this project. Again, we cannot address or fill our gaps, control diseases, if you don't work closely with our partners. And I think today I'm very happy to see the expertise, the support of Expertise France. We have other initiatives that we are working with the French Republic in general, but I think this Expertise France is, I think, a new partners, which I think is going to be a partner that we value very much. And actually, when I came here today, I met for the first time Madame there, and I directly invited her for a meeting tomorrow, so that to really explore other opportunities to work with Expertise, to really come up with such project. So again, we have also discussed about how do we make sure that we tackle this issue of people who use drugs. Again, the good thing for Rwanda is that we have a very good platforms on which you can leverage to really implement this project without any problems. The way we collaborate among institutions within the government is one of our strengths, which I think explain the gains that we have achieved through all our interventions. So on behalf of the Minister of Health, the Government of Rwanda, the Minister of Health, Rwanda Biomedical Center is committed to continue to work with all the NGOs which are involved in the implementation of this project, as we have done this from the beginning of the application. And I think my request now, is really to make sure that we continue to work together through the implementation of this project. And there's also some of the gaps that my colleague from mental health have mentioned. I think we need probably to ensure that we not only not duplicate all our efforts in different partners, in different projects that we have, but really working together as we implement, make sure that we identify additional gaps. Kagaba mentioned about the data. I think this is an opportunity through this project to generate some evidences, which I think is going to be very important as we are embarking in this particular topic. So again, I think this is something RBC will continue to support also, to make sure that we provide our expertise and support in I didn't see probably there somewhere the role of RBC, which is clear in the project, but again, HIV divisions, mental health, and also probably the tuberculosis, and also the research data innovation divisions. I think this is also another division that I think need to be involved in really supporting the collection of data, so that we really have enough evidence to really advocate. I think we have mentioned about advocacy. I think it appears several times advocacy, but it's good. But how do we again move from that advocacy from the beginning? So we need to really be planning ahead of time, so that after 3 years, we don't again come back and request funds for advocacies. So there are a lot of challenges, I think, that we have mentioned in this room. I think those challenges need to be kept in mind as we're implementing this project.
But just to say that if I am here, this is thanks to the fact that now there is what is called initiative. So this is part of Expertise France, which is a subsidiary of AFD Group. So AFD, this is Agence Française de Développement, the French development agency, which is both the cooperation agency of the French government and also a development bank. And within AFD, it was decided to create Expertise France a few years ago, which is, I would say, the equivalent of the German GIZ, you know. And then it's like les poupées russes in French, you know, within Expertise France, you have l'initiative. And I think initiative for the first time took the initiative. This is a repetition, but to have a representative abroad. And so this person is Marie Vicard, who arrived, I think, just 2 months ago, and will be here, hopefully, several years. And I believe that the fact that we are here today is also thanks to the decision of l'initiative and the combination, I would say, of your expertise. And we had a bright presentation from a specialist from the DG, of course, and the fact that there is because usually I think we call it the 5% for the l'initiative 5%. So now it's more than 10%, I believe. No, 20%. So this means 20%, if you like, of the French government funding to the global fund is devoted to l'initiative for financing projects like this one. So that's why, since Rwanda has been, I think, very performing, you know, in this field, with good results, especially this triple 95, but the DG was much better than me to explain. You can use this tool, I would say, you know, that initiative is to improve even your, I would say, yes, your results. Obviously. Drug abuse, I don't know, it's a serious problem. I must say that for me, I was not so much impressed by these figures. But what I understand is that if you really want to eradicate HIV, especially HIV/AIDS, of course you have to target this population, which is very often maybe outside the scope, of some institutions. I think there were also interesting questions about the role of the police on the RIB, and I am quite happy to see a representative of the Rwanda National Police and also the Rwanda Investigation Bureau. Of course, obviously, there must be some link, I would say, between the world of medical doctors, psychologists, social workers, and so on, and also the police. It's necessary in this field. Both prevention and maybe sometimes also repression, but with the right probably fine-tuning. So that's basically what I would say. Maybe I can say also a few words, about the action of the French government in the field of health in Rwanda. It's both actually through AFD, and we have one flagship project, which is the rehabilitation of the Musanze Hospital. It was signed, the convention just a few weeks ago, by two ministers, both Saban Nsanzimana and also Isiel Ndegejimana, so the mini-COFIN. And we have also, through the cooperation section of the French embassy, an ambitious, program of forming medical doctors, but not generalists, specialists. And we go to France. They can spend 1 year in French hospitals, mostly in Paris, hospitals depending from Assistance Publique des Hôpitaux de Paris, which is a huge public organization. And after 1 year, they come back as specialists, like in, in cardiology, in I will say it in French, in médecine interne, médecine d'urgence, néphrologie, whatever, dermatology, pédopsychiatry and so on, And I think this way we have a kind of, maybe a toolbox, if you like, which is quite comprehensive in many, many fields. And I am quite happy to see that now we have also the initiative. I'm quite happy to see that the Director General who is in front of me discovered just today that Marie Vika is here in Kigali, and that they are going to meet already tomorrow, which shows that there is a big interest, within the Rwandan institution about what we can do together. Because of course this has to be a partnership with both Rwandan government institutions, Rwandan civil society and the NGOs, and the French, I would say, cooperation tools, and specifically the initiative for this project on reducing the prevalence of AIDS, and that's it, within the how do you call them, people who use drugs, PWUD. I don't know how we say that in French, but well, this is obviously a very necessary goal. Even if, as I said, maybe I shouldn't say that, but when I saw the figures, I don't know, I was not so impressed, but maybe it's because it's difficult to have the right statistics for such a population, probably. And also it's not because the phenomenon looks maybe small, that of course it's not controlled, it can grow big. And also, obviously, now that's what the DG say, this is the last mile, so the most difficult. And this is the problem of this population has to be addressed also. So thank you. I wish you the best in the implementation of this project. Thanks.